myself. So welcome everyone. We've got the it's the first go at the combined webinar, so incorporating Practice Council and the NHC webinar. So we've only got a meeting a month. So yeah, got a few presentations. So any questions, please put them in the chat bar, raise your hands, and we'll come around to you. We'll start off with some quite sad news actually. Dr Zakaria, who was a GP locally for many years and worked at Upper Road Medical Centre, I believe in Plaster, passed away just recently. So I don't know if Sabine going to say a few words, but we seem to do this quite frequently now, unfortunately, doing it kind of every other month almost. So really sad news. So Bill, I don't know if you want to say any words. I met Dr. Zakaria myself a few times. I think you're on mute, Sabir.
Can you see the screen?
Yes, we can, yeah.
Yeah, thank you, Nadima. It was a great opportunity to speak about one of our colleagues who has really dedicated his life for Newham. Dr. Zakaria was not only a GP, he was a people's man. This is the man who was only worked for people, he served the people. He served the patient, he served the colleague, he served the family. So I don't only see him as a man who is only have a technical knowledge and just being a GP. He was a proper human being who really does matter to people's life. So I am just going to really, it is very emotional to speak about Dr. Zakaria. Any GP that I need to speak to about these things, I feel very bad because we work as a general practitioners, but we don't know people as a human level. And I really wanted to tell about Dr. Zakaria, that who he was as a human being. So if I just start with this little bit of his story, that how he came to the general practice. So he was an overseas doctor, like many of us. He's an international medical graduate. He was qualified in 1969 from one of the medical college in Sylhet, where the most of the Bangladeshi people came to this country. So since he has came to the UK in 1973, he worked in Yorkshire and many of the hospitals in Wales before he got accredited as a GP. Then he came to East London. He was trained in Walthamstow as a GP. And then he worked with another late GP, Dr. Bibi Chaudhary. He had a surgery in Stafford Road. So he worked as a colleague. And later on, he's developed his own practice in the Upper Road. The surgery was on 50 Upper Road, you can see, and you can see how it looks like. The whole point of giving this picture, that so much memory and so much hard work this man has given to develop this practice. And then, but he was not even out of any kind of things that GP goes through. So he's been stoned several times to the surgery because of the violence. That time it was quite common. Now we have zero tolerance. That time people tolerate it because they just get on with the life. They think we are here to serve people. We ignore some other bits. So he set up this Upper Road Medical Center in 1986, and then he continued as a single-handed GP till he retired in November 17. He went through a lot of struggle and challenges, like many of us as an international medical graduate. When you come to this country and have a lot of hurdles we need to cross. But he did really provided the service. He built his surgery. He has built his own network. He served the patient, and he was really hold the Newham population with courage, dignity, and respected and really trustworthy human being. So he delivered what he knew. He was never a politician. He never got involved with any kind of dispute with anyone. He was a very highly respected, very smiling, very, very quiet gentleman. Now, what I wanted to see about Dr. Zakaria, that I have got it from my other colleague. This is from these are all the information I received from different people. Some of the information I received from Bangladeshi paper who has written about a lot of things about him. So he was really loved his job, and he also loved by the lots of patients. The patients are everywhere in Newham. They always talk about Dr. Zakaria is still there till 10 o'clock in the evening. He was there Saturday, Sunday. He was always there. He's the person who is the grassroots general practice was looked like in the past. So this is a really encouraging from new generation GP that how the general practice used to be in the past with lots of GP that provided in the past. So I have few lines from one of his colleagues, couple, Dr. Shah and Dr. Sudha Shah. They just was going to say some kind of tributes to Dr. Zakaria. So he was really kind and generally silent gentleman in the community. He hardly used to speak. He used to go to the GP forum. He used to sit down one corner. Anything he needs to just, he used to very quiet. He mutely speaks to people. He was never vocal. So this is the man who was really built to serve population. So he's always supported general practice development and education in Newham. That's Dr. Shah also believe. And he worked with many years with Dr. Shah, and he's a privilege to associate with his practice and the family. This was really a family-run practice, and it was the whole family was involved in providing the service, and they have helped Dr. Zakaria in many ways. So the whole family was relentlessly works together in the practice. So we all deeply sorry for departure of Dr. Zakaria. So we wanted to really provide our condolence to the family. This is the last things I wanted to tell from last night from the daughter, which touched my heart. He was the family's lighthouse. As you know, without lighthouse, how dark it is. But in this difficult time, we wanted to convey our sorrow to Dr. Zakaria family. He's always respected, he will be respected, and we will follow the pathway he has designed. Dr. Zakaria, wherever you are, we'll remember you for the rest of our life. Thank you.
Thanks, Sabir. Obviously, really nice words from you, and understandably quite difficult as well, seeing as you worked with him for many years locally. But yeah, really sad news, and condolences to the family and to all those that knew him. Thank you. Steph, can we move on to our next agenda item? It's hi, Kat. Nice to have you back in Newham. So, Kat, if you don't know her, he's a GP at Tollgate and previously a board member in Newham CCG and Training Hub as well, chair. So she's now one of the NEL 0 clinical leads for North East London. So I'll hand over to you, Kat.
Thank you. And it was really lovely to hear those words about Dr. Zakaria. Thank you, Sabir. So yeah, as Nadeem said, my name's Catherine. I trained to be a GP here in Newham and qualified in 2016 and worked here since. And I'm going to talk really briefly about some carbon literacy training available, and I'm going to explain what that means. So I did a sustainable primary care course last summer, and in January started a role as one of the net zero clinical leads for the NEL ICB. So why am I here talking about the climate crisis? And I know at the moment we're all overwhelmed, and talking about another crisis feels like it might be unhelpful. But actually, hopefully, I'm going to persuade you that all action on climate can help us and our patients. So on this first slide, you can see in March, the UN Intergovernmental Panel on Climate Change issued another stark warning that the pace and scale of climate action are insufficient to tackle climate change. So we're in trouble and time's running out. And they also wrote that those who contributed the least to climate change are often the most vulnerable to its impacts, which I think that second part is really pertinent to Newham. And like a lot of this crisis, it's the least advantaged who are the most affected. An example for us here in Newham is having the worst air pollution in the country. So the NHS at the moment contributes about 5 to 6% of the total UK greenhouse gas emissions. Primary care is about 20% of that, which when we're doing about 90% of the activity isn't bad, but it's still a lot of greenhouse gas. And significantly, the NHS is the first health service globally to have pledged a net zero target of 2050, and here and now our target is 2045. Next slide, please. Where are we now? So you can see this graph. If you're looking at primary care, which is 5th across, you can see our big spots or emission hotspots are a little bit buildings, a lot inhalers, medication generally, and staff and patient travel. And this is where I hope to persuade you of the good news about sustainable healthcare, which is that insulating buildings, prescribing less medications, better asthma control, more active travel, which means better fitness, less air pollution, using green spaces, creating green spaces and practices, social prescribing, all of these things drive costs down and should drive demand down and also boost staff morale as well. Next slide, please. That may sound like a lot, but don't feel overwhelmed, please, because the first step in this is to work out at practice level what your carbon emissions are, and then make a plan as to how you think you can lower them. And this is what the training offer is, and it's open to clinical and non-clinical staff. We're saying maximum 2 people from each practice, so that as many practices as possible can access it. And if 2 people sign up from one practice, we recommend ideally that you do it on the same day together. And the most ideal scenario is that you have one non-clinical person with sort of a bit of estates and buildings knowledge, and the other person is clinical. It's about 4 hours of online reading and then 1 half day of group work with about groups of 12 learning together about how to carbon footprint. And this is with a chap called Matt Sawyer, who is a GP and very passionate and inspiring guy. I'll share the doodle sign up on the chat and it will come out hopefully in the newsletter that follows this meeting. Next slide, please. So yeah, I think that slide should come out, or if yeah, that's brilliant, go for it. So just what can we do? Become carbon literacy aware, get trained, know our carbon footprint number, as it were, and then try and bring that down. There's also at the moment a green team competition available to apply to if you're in a practice where you're particularly motivated in the subject, either at a practice level or PCN might want to have a go at applying. And I'll share information on that with the team to share on the newsletter as well. Any questions, welcome, and that's all for me today, and hopefully I'll be back, and thanks for having me.
Thanks, Kat. So you'll be sending out the details of the training. So we'll send it out, Karen, in our newsletter or in our email. I suppose it's a really important area, quite a lot of training there, but such an important area for us to focus on going forward.
And there's going to be more as well. This isn't just sort of one and then that's it. It's going to, the training, we've got a lot of money from HE to do lots of training for North East London. So it's really, really good. We're really lucky to have got that.
Okay. Any questions at all for Kat? I mean, how is it going across North East London in terms of, has the training started, or is this the first time?
So this is the first time. Yeah, this is the first rollout of carbon footprint training. There was the sort of health scholars work which I did last summer, and that's with the Centre for Sustainable Healthcare, and that's who the next cohort of courses that are going to be available are with, and they're really good. So it's really exciting that we're going to be able to bring that to more people.
Okay, Karen?
Yeah, I just wondered, Kat, whether Federation colleagues might be able to attend that training, and or I'm just thinking PCN clinical directors and so on. You know, I appreciate you've got a sort of fixed number of places, but I'm thinking, I know Dr. Bapu, you've been inquiring about this aspect, and just thinking we might be able to support colleagues if we know a little bit more about how to take it forward.
Absolutely. I think it'd be brilliant if a Federation person did the course. That'd be fantastic.
Okay, and Rima?
Sorry, Nadeem, I did take my hand down. It was just actually just to mention that, Kat, I know that you've kind of had conversations with our LBN colleagues as well in terms of our kind of partnership. priorities around this area. So it would just be helpful if you can just give a real brief outline of how you've been working with them as well.
Yes, so, and that also comes into the training. So this particular package is just for primary care, but all the other stuff that we're rolling out is going to be system wide. And also the green competition I mentioned is system wide. So hopefully we'll get borough trust primary care teams and have these 6 teams having competition to see who can reduce their carbon emissions the most. But yeah, so we're Newham has a really strong, as you probably all know, public health team, and they're already doing really great work, especially around sort of safe streets and air pollution. We've just put up a air quality monitor down the road from us at Tollgate, in collaboration with a primary school. And they're also doing loads of work around food, so making sure that especially kids are getting healthy food, but also looking at from a sustainability point of view. So yeah, I mean, there's lots happening and it's very exciting.
Yeah. Any kind of, I know First for Health were doing some work around this, and I think I spoke to maybe Bapinda some time ago. I don't think he's here today, but they were kind of making changes internally. I think getting rid of polystyrene cups, and I think coffee and tea. So I don't know if there's any other kind of ways practices can make slight changes.
Yeah, definitely, and it's all about small things, isn't it? And another sort of that I should have mentioned, so North East London ICB has just declared that they're a fair trade workplace, and they're encouraging all workplaces to be fair trade, and what that involves is just making sure that in your staff areas you have fair trade options, so fair trade option of coffee, tea, sugar, and once you've got those options, you can register on the Fair Trade website, and they sort of send you a PDF certificate and you can put it up, and just those kind of things raise awareness, don't they? And they also make you feel good about where you're working and what you're doing. And I should also mention the borough as well, sort of working on growing, sort of growing food, growing vegetables, that kind of thing. And obviously we need to tie up all the social prescribing with that as much as possible and get people out into green spaces, cultivating, gardening, eating the right things, walking, cycling, all of these things are all tied in. So
Manuel just mentioned cycling to work, and we've got a few GPs who do that and colleagues. Sabir?
Welcome, Catherine, after a long time.
I know. Children, hey.
Again. Now, listen, one of the things I need to add about this 15-minute city.
The which, sorry?
The 15-minute city where we are trying to get all the services around 15 minutes walking distance from the patients.
Okay,
and that is where the neighborhood, the all debated neighborhood model coming. So is there any kind of plan to redesign the services within 15 minutes of walking distance rather than people using cycle, motorcycle, or the cars?
Yeah. I haven't heard of anything, and I didn't know about that initiative actually. So thank you, because I'll look that up and see what we can do around that.
Okay. I suppose remote meetings like this and remote working help, don't they, Kat?
Yeah, it's a huge reduction in carbon, not having face-to-face. It's definitely more sustainable.
Okay. All right. Can't see any more questions, so thanks, Kat, for coming down, and hopefully we'll send out the information, and let's see how it goes, and if we need any additional push for for taking up places, we can come back. Is that all right?
Yeah, that's brilliant. And as I said, hopefully I'll be back to tell you more about what's happening. And thank you for having me. And also, sorry if I have to drop off. I'm off the call. I'm looking after my 3-year-old.
That's fine. Yeah, we'll have you back
Paw
soon.
Patrol is looking after her, but
that's great. All right, thanks, Kat.
Thank you.
Should we move on to Lauren, who's going to talk to us about weight management and give us an update on the weight management programme. Hi, Lauren.
Hello, good afternoon, everyone. Do you have the slides, or do you need me to share my screen? Oh, you do. Perfect. So hello everyone. So my name is Lauren Munnelly and I'm the Head of Transformation from Xyla Health and Wellbeing. So I'm here today to talk to you about the Live Well Newham programme, which we've been delivering in the borough for the past 2 years. However, we've recently gone through procurement and we're excited to announce new arms and additions to our service as well. So next slide, please. I'm hoping you guys are aware of who Xyla Health and Wellbeing are. We're not an unfamiliar face to you. So within North East London, we also provide the NHS Diabetes Prevention Programme, as well as the NHS Type 2 Diabetes Remission Programme, which was formerly known as LCD. And of course, the NHS Digital Adult Weight Management Programme is also available to residents as well. So we work with over 29 local ICSs and local authorities, of which, of course, with our Live Well Newham programme, the London Borough of Newham Council. So if we can move on to the next slide. I always get conscious of timing, so apologies if I start speaking really quickly. I've got a habit of that. So in terms of the kind of local landscape, when we're looking at Newham and understanding why there's a need for a weight management and movement service. So in Newham, we see high rates of obesity compared to the England average, and it's a similar picture when we're looking at our children and young people, where we also see the rates of overweight and obesity being worse than the England average as well. So as we know, the high prevalence of obesity presents a number of challenges. So for the individual themselves, in terms of health and increased risk of morbidity and mortality from conditions such as type 2 diabetes and hypertension. But not only physical, it's also considering the kind of psychological impact as well. And we know that obesity is associated with poor mental health, and being overweight can kind of cause reduced self-esteem as well. So a sedentary lifestyle is associated with excess weight, although physical activity is proven to have positive benefits for those health risks that I spoke about earlier, as well as improving mental well-being as well. Yet we see within Newham, only 51% of residents are physically active, which is 12% lower than the England average. We also know that there are certain ethnic groups that can experience the impact of obesity at a lower BMI threshold. And we also know that people affected by deprivation are more likely to be overweight or obese, and that's in part due to kind of higher costs of the higher costs of healthy food, and also the wide availability of kind of low cost and low prep time foods of unhealthy ones as well. And what we see is that less than half of adults are meeting the 5-a-day recommendation. So what are we here to do about that? So if we could go to the next slide, thank you. It's formatting a little bit strangely, but so in Newham there are 4 different kind of core interventions that we have on offer for Newham residents, which are of course free to attend. So our Live Well Newham programmes have been developed by a qualified and experienced team of dietitians, psychologists and physical activity specialists and medical professionals to support patients in achieving their weight loss goals. So all of our programmes are 12 weeks long and they start with a one-to-one booking assessment, and they all address kind of nutrition, the psychology of behaviour change and physical activity. Next slide, please. So first, I'll talk about the offer that we have for adults within the borough. So we've got 3 core programmes. So Live Well Newham, which is the kind of overarching service name, what we've been delivering for the past 2 years, which is our weight management programme, which covers all aspects of health, so nutrition, behaviour, physical activity, and some sessions will include a practical physical activity element. For our Live Fit Newham and our MFit Newham programmes, the theory section is shorter. However, each session then will include a practical physical activity element. So to give you an idea of some of the topics that are covered within our sessions, it's things like exploring energy balance and macronutrients and portion sizes, understanding the guidelines for physical activity and breaking down any barriers, and kind of tips for kind of planning, shopping and understanding food labels. Next slide, please. So to be eligible for our adult weight management programmes, both for Live Well Newham and the next slide covers the Live Fit Newham. So it's for Newham adults over the age of 18 who have a BMI over 25 or 23 for Black and Asian heritages. The exclusion criteria is documented on the screen as well, and hopefully these slides will be shared afterwards. So with our adult weight management programme, the core offering will be a face-to-face service, but we do have, largely from learnings from the pandemic, we do have a remote offer for service users as well. After their 6-month review, the service users are discharged from the service, but they get access to our 12-month support package. So this is to ensure that our service users have all the support that they need post-programme for continued success. And our expert team of clinicians have developed a series of 12 webinars to keep individuals on track and stay motivated for the long term. Next slide, please. As I mentioned, it's similar for our adult physical activity programmes, the kind of key difference being that our physical activity programme is only a face-to-face offering given the nature of the programme. Next slide, please. So now I'm going to talk to you a bit about our children and young people weight management offer within Newham, which we call Healthy Futures. So this is for children and parents who are looking to understand more about how to eat well and kind of develop healthy habits as a family. So typically groups are split between primary school age, so around 4 to 10, and then secondary school age from around 11 to 17. So activities within the session include those that cater for children as well as the accompanying adults, whether that's a parent or caregiver. And again, to give you an idea of some of the kind of content that's covered, it's looking at things like snacks and drinks and discovering fun family swaps, understanding portion sizes, again, benefits of physical activity. And a real key one, particularly for the kind of teens, is looking at the kind of health technology and helpful apps and how we can make kind of activity tracking and things like that fun. Again, this will be a face-to-face offering, just given that the cohort is better to engage in a face-to-face setting. Next slide, please. So as I've mentioned, our core kind of primary intervention offer is a face-to-face service with app-based digital service support, which I'll come on to a little bit later. But for our adult weight management programme, we do have that remote offering as well. So that can help support patients who potentially are unable to leave their home, whether that's due to low mobility or still kind of some residue from the pandemic of not feeling comfortable in group situations, patients who are unable to travel. We do also have tailored sessions that we can deliver. So for patients who require groups in a specific language, or if they prefer gender specific groups as well. And what we'll also have is an opportunity for service users who miss a session, whether that's in the face-to-face programme or the remote, they will have an opportunity to catch up on any missed content as well. And that's just to ensure that they feel that they've got all the information they need and they feel they can continue on the programme as well. Next slide, please. So in terms of, there's a lot of ones to load on here, I do apologise. So just to give you an idea of what service users get as part of our service offering then. So the key one to discuss is what I was talking about earlier in terms of our Wellbeing Way app. So this hosts a number of resources that allow service users to do things like tracking. They can access a whole host of additional reading content. They've got an e-learning platform so they can cover content within the sessions at their own pace. And the app also includes integration with Xyla, which is a personalised exercise prescription app. So it's an effective tool for kind of supporting personalised physical activity programmes to help service users increase their PA levels. They also get access to resources such as handbooks. So this is looking at, nutrition, physical activity, behaviour change, all in one place. And they get kind of incentives for completion of the programme. So whether that's access to the recipe book, and a kind of real key part of all of our services is that kind of onward signposting and kind of utilising what support is on offer within the community. Next slide, please. So I am slightly conscious of time, and when I time myself doing this, the next 3 slides I couldn't actually include in the time. So I'll make sure that hopefully these will be shared afterwards. But what the next 3 slides cover is essentially what our kind of core accessibility offer is, What we do in terms of kind of tailoring, and particularly to do with cultural tailoring, and just how that that overall service user journey looks like from start to finish, and how we can support service users with different needs throughout different points in their journey as well. So if you could please skip the next 3 slides, and I'll come on to the. Thank you. So to give you an idea then of our service user outcomes then, so as you can see on the screen, 77% of our service users from ethnic minority backgrounds start our programme. 86% of completers are from the most deprived wards in Newham. 76% of service users who complete our programme lose weight. 96% said that it helped them improve their diet, in that's supposed to say eating habits, and 92% of service users rate the service as good or very good. Next slide, please. So the next 2 slides again, within the notes section, you'll be able to see the link to the case study, but it's just to give you an idea of some of the real life examples of service users in Newham. So this is Maz, and the next one is Sonia. So please do take time to have a read through those. So in terms of referrals into the service then, so we have a referral form for the adult services and a referral form for the CYP, the children and young people service as well. So these should be embedded into the clinical system. So we've been working with PRIT to ensure that that's available. And then that referral form can be sent directly to our nhs.net email address. We do have an on-the-ground engagement team who can support practices with any kind of retrospective searches. So whether that's, I can never pronounce it, is it Accurex? Let's say that it's that. Thank you. So we can support practices with kind of sending out mass texts or whatever it might be. And of course, we've got the self-referral route as well, which can be accessed via our website and completing a web form, which is all linked within the slides as well. As I mentioned, we do have a senior engagement lead on the ground, as well as a regional manager who can really support with primary care and other referring organisations about how we could just best support your practice in whatever way you see fit. So we have supported with kind of invite letters out to service users. We can provide kind of marketing materials to help promote the service. We've got a video that can be shown in GP waiting rooms. We are looking at having the offer of kind of patient information sessions that can be held at any PPG groups, as well as parent information sessions with the introduction of the CYP programme. We've got some healthcare professional training about how to raise the issue of weight, and this is currently going through CPD accreditation. So hopefully once that's finalised, that can be re-promoted as well. Of course, if there's any sessions that you want to come along and shadow, please by all means do get in touch with us. We'd be happy to facilitate that. In terms of kind of advice, so we do understand things like the incentives for practices, and I understand the enhanced weight management service GP incentive has been extended into the next financial year. And of course, it's just attendance at anywhere you see fit, whether that's practice meetings, whether it's meetings like this, PCN meetings, however you see a presence about this service being useful for your practice, then please do get in touch, because we'd be more than happy to support with that as well. The last slide then is just contact details. So there is my email address on there, and I can forward on any relevant queries to the team on the ground. And then we've just got our website there, which you can get information about, you know, where our face-to-face groups are, the information for service users, the self-referral form, and of course a shameless plug for social media as well. So does anyone have any questions for me at all? I think I can see a hand up.
Thanks, thanks, Norman.
No problem.
What's available for patients who don't meet the criteria? So obviously a big focus on prevention, not just treating once they're obese.
Yes, of course. So I understand in terms of the plans with the council is there will be the introduction of the Well Newham Hub, which will be that kind of one-stop shop for tier 1, tier 2 support, with coaches that can either, you know, signpost back into the community, you know, any social prescribing, which I know was discussed earlier. So I'm sure more information will come out about that I say Live Well Newham, the two can get confused, the Well Newham Hub at a later point as well to support service users.
Okay, that's fine. Manuel?
Hi, my question is about one of the feedback from the health and well-being coaches about picking the weight management patients back to the general practice is your coaching are they tailored to the individual patients, or is it a kind of a program that they will go through? That's one of my questions.
In terms of with the information that's within these slides, those 3 slides that I skipped over, it does talk about how, of course, the kind of content of the sessions don't differ greatly, given that the advice for healthy eating, physical activity remains largely stagnant across different groups. However, our coach training is really geared towards how, in terms of coaching and delivery style, can be tailored to meet the kind of needs of the group. So we do have specific groups that we focus on. So whether that is a gender specific group or a male only physical activity program, or whether that is a language group, and you'll see the information in terms of, language specific groups, the resources that our service users get in terms of translated materials. So it's tailored in terms of style and delivery, as well as the resources that are available for service users as well.
Okay, so what kind of techniques? What kind of techniques do you use? Do you use like motivational techniques, or?
I think the information is in the pack as well, Manuel, in terms of how it's tailored, culturally appropriate. So I think that there has been some consideration, but I'm sure you have a feedback system.
Yes,
for that.
Absolutely. And I'd also just say to look at the notes as well within the slide deck, because that explains a little bit more about our, our cultural awareness training, our disability training, and how that's kind of embedded from the outset.
Okay, Tammy.
Thank you. Thank you.
Thank you.
Thanks. Hi, Lauren. Hi, Josie. So just probably to pick up on that point as well. So obviously, I've been involved in the type 2 pathway to remission, formerly known as LCD. So one of the things that's really important is that there are going to be some patients who that process or that program isn't suitable for them. They're not eligible for that, or they don't want to have the soups and shakes, but actually this is a viable alternative.
Yes.
So what's really good about when you have those consultations, it's about looking at what we've got available to us in Newham, and we're quite lucky that we have this. So I just wanted you to kind of look at this from a different lens about the fact that if they're not eligible for any other weight management, then actually this captures quite a lot. So hopefully that helps, Manuel. My second point was about where we need to, sort of disseminate this information. So I think, it would be really helpful, especially with the CYP, coming online, which is brilliant, to get out to sort of the schools and the local, our local sort of voluntary sector organisations, our mosques, our churches. I think we just need to get the message far and wide, so that we are having patients who are wanting to come to us to have those discussions, rather than us having to sometimes in a very short period of time bring up the discussion around weight, especially as we don't necessarily have up-to-date BMIs for children. So we really do want that to sort of link in, and I think especially with the school nurses going in and doing sort of the checks, say in year 6, be really good to link in with them, so that they're aware of this program if you haven't already done that.
Yeah, absolutely.
That's really helpful.
Yes.
Jyoti?
Hi, everyone. Just wanted to pick up on the point that Manuel, raised about there will be obviously some people who may not be sort of, they may not kind of, benefit from universal programs like these. And, as part of the larger DPV, which is the dynamic purchasing vehicle, we do have category 4, which still hasn't been sort of rolled out yet. But the expectation is that there will be some, smaller pots of funding for doing some one-to-one work for people with these kind of, complex needs. It is still sort of, it's not been rolled out yet, but, we will come back to the forum when we have more information about that. But the expectation is that, universal programs like Live Well, Newham and all, they should be able to sort of, help most of our residents, by and large.
Thanks for that. Anything else in the chat bar, Karen?
No, you've covered all the issues that were raised, I think.
Just Susanna was asking about healthy futures. Is that the same?
Sorry.
Oh, sorry.
How do we refer to Healthy Futures? Is that the same
Healthy
as?
Futures is the CYP offer, essentially.
Okay. All right. Thanks.
Yes.
Hope that clears out. All right. Thank you very much.
Perfect.
I think what we can, sorry, what we can do is, I can share some screenshots of these EMIS forms and maybe just share it with the forum later, if that helps.
Well, we can send it out. If you pass them to us, we can forward them.
Yeah, happy
Thank
to
you very
include
much.
that in the information, Jyoti.
Yeah.
Great,
Thank you, Lauren and Jyoti, for coming down.
Thanks,
Thank
everyone.
you.
Bye. Karen, you want to do the recruitment day?
I'll be brief because I know Rima and Wax are ready to pick up the Practice Council content. So if we just move on, Steph, it was really just to advise all colleagues of the planned recruitment day for the 28th of April. Working with the training hub, NHC has got an open day, if you like, to encourage more people to enter into healthcare roles in Newham. We've got an online process for booking appointments, so people can come and pre-book to have an interview. And obviously the range of different people that will be attending the recruitment day will help new entrants to understand what sorts of roles we have. And it's not just for NHC recruitment, this is recruitment for our staff in the primary care networks, but also for staff in the general practices themselves. So one, wanted to make you aware of it. And Steph, if we just move on to the next slide. Again, if colleagues have the opportunity, we've got some posters that if you're able to put them up in your practices or make them aware in terms of any networks you have with voluntary groups or community organisations. It just gets the word out and allows more people in Newham to be aware of the opportunities. And then finally, Steph, the last one is all the various online opportunities if you're digitally savvy and you can promote the recruitment day. Just keen, everyone knows we've got pressures in terms of recruiting staff. And so the more we have at that sort of entrance door, then the stronger the opportunities there. Please do reach out to us directly if you want to be more involved, but just for now, wanted to make sure you're aware that that's going on. Thank you, Nadine.
Okay, thanks for that, Karen. Yeah, I'll hand over to Wax and Rima now. So Practice Council, thanks.
Thanks, Nadine. Thank you. Steph, oh, thanks. You've popped the agenda up. Brilliant. Welcome to all to our New Look Practice Council. New financial year, New Look Practice Council, April Practice Council. So welcome to you all. We've got about 45 minutes. There's always plenty to get through. So trying to chop a 2-hour meeting, which historically used to be, into 45 minutes is going to be an interesting one. But thank you to NHC colleagues for completing their part on time. A couple of matters arising before I go into the first item. I'm just going to pop something in the chat bar. If you could just, we've been asked to give some perspective and reflection around the impact of the junior doctors strike on primary care and PCN services. So it'd be really helpful if you could pop your thoughts in there. I'll pop what our practice has said in there now. So if you could just sort of, while we're running the session, just pop that in there, and then we can capture that and then feedback to the commissioners and those kind of responsible for supporting with the junior doctor strike. Again, also thank you to Sabir for saying kind words about a lovely man, Dr Zakaria. I always remember Dr Zakaria being one of the front row attendees at Newham Hospital when we used to do the Practice Council and the GP Forum at Newham site. A lovely gentleman, a lovely family man as well. Sabir's absolutely right, a people's person. Spring Brewster campaign. Oh, I can't believe I'm saying this. Phase 6, ladies and gentlemen. We're absolutely starting phase 6, and in fact, Nabila, Paula and Karen and the team NHC have already been roving around the care homes. Yes, that's right. Surprise phase 6, and officially, we expect that you'll hear more about it in the news from this evening and over the weekend and Monday morning, if we can move away from kind of the Northern Ireland kind of Biden visit kind of situation and the Man City kind of situation. But yeah, so you'll learn more about it. And the slide that Steph just kindly put up, there's just some notes there for you. Phase 6. A little bit different to the main phases, and reflects more and aligns more with what we did in springtime last year. The Green Book has been updated to include the new vaccines and the adverse and side effects of those vaccines and how they fit into the new program. The eligibility is pretty closed now. Okay. 75 years and over, residents in care homes, and 5 years and over who are immunosuppressed. And it's important, if you get 5 minutes, because you will get asked the question in a couple of days' time probably, and over the coming weeks, that where last year in the Spring Booster campaign we were vaccinating immunosuppressed, but the whole capture of that immunosuppressed table, that list was much more than what it is in this program. So where we had some who were clinically extremely vulnerable, who were deemed as being immunosuppressed, that's not the case now. So the criteria is much more closed. And, you know, we're talking about those who are on, who have received bone marrow transplants, those who are on immunosuppressants, those who have genetic and neuro disorders that result in immunosuppression. And you can take that from table 3 and 4 in the updated Green Book chapter 14. What I will be doing, I'm hoping over the weekend or Monday, just depends on how NHS England allow us to communicate out, but I'm sending out a leaflet that you can have for waiting rooms and reception areas, and I'll pass it on to NHC to distribute as well. That makes it quite clear on what the immunosuppressed kind of cohort eligibility. And 75 years and over to have the Sanofi. So some of us might think to ourselves, well, we've just got our residents used to Moderna and Pfizer, and we've overcome the whole AstraZeneca kind of situation. Yet there's a new one, there's Sanofi, and that's predominantly for those over the age of 75. Karen, is Nabila on the call, just out of interest? Nabila, are you on the call?
I don't think I've seen her.
Okay.
Don't know.
Paula's
He
on the
isn't,
call.
no, he's not actually working today, I'm afraid.
Yeah, Paula's brilliant. Paula's there. And then we do have a new Pfizer vaccine. This vaccine will be used for first dose, second dose, and for those patients, residents who are eligible for the booster. It covers newer variants and subvariants, etc., and that's for those who are over the age of 12 years and over. We had this kind of nuance last time round where we were looking at year 7 and year 8 12-year-olds, and that's kind of gone now. So it's 12 years and over, and you're eligible for the new Pfizer vaccine. That will be your first dose, your second dose, and for those who are eligible for spring booster eligibility, that's the one that you'll be offered. The gap has changed. It's changed quite a lot over the various phases. We're down to an 8-week gap on the first and second dose, and the gap between the second dose and anybody who's eligible for a booster remains at 12 weeks, 3 months kind of situation. Right now, because we've said that immunosuppressed children 5 years and over, and also first and second dose is what we're working on in this phase. The pediatric vaccine, the orange top vial that you'll be used to, is the one that we're using. There is an updated one for the 5 to 11 cohort as well that hasn't been released yet. A couple of other things. In sort of care homes, nursing homes kind of situation, we've removed that kind of 28-day wait till you've had COVID kind of situation to make sure patients' residents are vaccinated promptly. The length of the phase is we're looking to end on June the 30th. That's my understanding. At this moment in time, and nobody's really spoken about an extension past that. And what we also understand is that the first dose, second dose evergreen situation will also end on June the 30th. Paula, was there anything else do you think it'd be useful for colleagues to know? I mean, we'll be sending out lots of information as well. And there's going to be plenty of promotion for our NHS England routes as well over the coming days. Our 3 sites, yeah, Paula.
You know, I was just going to say that was really helpful. I guess the only other thing is the recent announcement around the 0 to 4-year-olds, which for the children with immunosuppression as well, which starts after the 30th of June.
Yeah, brilliant, Paula. Yeah, so you would have seen that in the news, the pulses, the HSJs, and I think that the BBC got hold of this one first before anybody else did. And Paula, they've given us a couple of months to have a think about that, but yeah, Paula's right, 6 months and about 4 years old. Those who are clinically extremely vulnerable, we understand, will be offered a COVID vaccine. Yet to know absolutely the complete details, but rest assured the teams that are who are heavily involved right now and with phase 6 have already started to think about July and that phase. I don't know whether they're going to call it 6A or 7 yet, Paula, but yeah, that will be fast approaching as well. Just on the 3 sites, so SLG, Wood Grange and Essex Lodge. Paula, correct me, I'm not aware on Actirex of any other sites right now, but there may be, and of course our roving team will be going out as well. Please do email me or call me or put on the WhatsApp if you have any questions about anything around the programme. Drop any questions in the chat bar if you like as well. That's all. Paula, do you think there was anything else, or if there's any immediate questions from colleagues? Monday's the official kind of start date, 17th of April.
Yeah, I don't think so. Other than to say that there are also 3, I think there are 3 pharmacists that have been approved. There's primary care sites in Newham in total, 3 practices, 3 pharmacists. And yes, in terms of the roving team, they started their care home visits this week. So they've done 2 care homes, the 2 largest in the borough this week, and then the static activity starts next week at SLG.
Brilliant. Paula, Manuel is asking around the CEG search. My understanding is there are CEG searches, right?
There are, yes.
Yeah. Manuel, I haven't had a play with the CEG searches yet to see whether they're sort of working well and stuff like that. We will do. I think the 3 sites have really heavily relied on MBS and Walk-in and Accurex booking, and we have texted out to everybody who's eligible, and will continue to text out to everybody who's eligible. That self-book kind of stuff really works, and over the coming days and weeks we'll because it is a short kind of program, we will need to talk about where we are with uptake and stuff like that, especially for those who are eligible in the immunosuppressant and the over 75 kind of care home, nursing home kind of situation. because cases seem to keep going up and down, don't they? It's absolutely not gone away. If there wasn't any questions, I know we're absolutely pressed for time. If we could move on to the next item. Sorry, I feel like I'm doing lots of talking. Nadine did say that at the top of the meeting, but these are all kind of actions that we'd had, learning needs that we'd had from previous practice councils. So yeah, you can see that up on your screen, the new CQC single assessment framework, and I've got about 12-13 minutes to talk about it. That's probably not going to do justice. I've got friend and colleague Sabir here who will be able to chip in as well. But I wanted to start the conversation on the new CQC single assessment framework. CQC, you know, is always in our minds and sort of everything that we do, and it is changing. It is going to be relatively different to what we've experienced previously. Myself and Sabir actually did a webinar on March 23rd, which has been recorded. It's on YouTube. You can access it via the Training Hub website. We can get the link shared as well, Karen. It also had, and Steph's actually put the slides for that webinar in the pack. They're accurate. They won't be changing much, I don't think, but we'll keep an eye on that. And what we do is, when we're talking about CQC, what was keen to do, and has spoken to Sabir, is that maybe if we chunk it up and just try and introduce a single assessment kind of framework today, take a few questions. The chat bar is there as well, and then just let you know what's coming, and then in future council meetings, the next couple of meetings, pick up on some specific key areas. And by that time, we believe CQC will look into land probably with the new assessment framework around kind of August. Right now, that means we're in this kind of transitional kind of stage. So Steph's kindly put up this slide. This is what's kind of going on at the moment. So, you know, the basic kind of situation. Karen, that's the CQC monitoring approach. You know, on the Training Hub website is our own kind of you know, Sabir and Wax alternative guide to CQC, which 189 sort of people attended in 140 different practices from North East London, and then it kind of covers everything, which we're going to be breaking down over the next coming council meeting. So as per this slide that you've got up on your screens now, CQC continue to carry out checks on health and social care services. They're doing their comprehensive inspections, and they're continuing to make sure that the services are safe, caring, responsive, effective, and well led. Historically, CQC used to base their inspections around key lines of inquiry, the CLOEs. That's going to change a little bit, and I'll touch on that. And of course, they do focus inspections, and in those focus inspections, they take a look at concerns that, you know, that might have been raised through things like whistleblowing or your access data and stuff like that. And this is what's kind of happening in this kind of transitional kind of situation. The other thing that these focused inspections look at is when, you know, there's a change in a practice kind of setup, a big change or a merger or an acquisition. Now, during COVID, I guess CQC Sabir had some time to reflect, and on the background of things like inequalities and access challenges, COVID, CQC's own profile and developing this. And then that changing kind of health and social care landscape with ICBs and borough partnerships and stuff, and all of that. CQC refreshed their strategy and have come up with this new single kind of assessment framework. And we'll talk about that in a couple of meetings, because we have got some time. But what I wanted to just touch on is that kind of direct monitoring kind of situation that we have at the moment, and that's kind of, and I see that as kind of a transitioning kind of situation. So there's some bullets there. Steph, could I get the next slide up, please? And this flow diagram I thought was the best kind of thing that kind of depicts what's happening at the moment. Steph, have you got a pointer or anything like that? Or yeah, brilliant. Are you able to just over to sort of wander around as I speak? I'll make it as simple and easy as possible. So guys, this is what CQC are kind of doing. I know at the top they're saying that, you know, they're adapting their approach. Absolutely, they're adapting their approach, but it is very much a transitional kind of situation until we get from the old way of inspecting to that new single assessment framework. So if you're right now, what they're saying is that if you're a practice here that enters into the start of this kind of flow diagram on a monthly basis, CQC inspectors are looking at your practice's information and the data. So that is going to be your GP patient survey, that's your ARDENS, that's your ECLIPSE, that's your QOF outcome, that's your smear outcomes, that's your IIF kind of situation. That's information that is reported to them about multiple complaints or whistleblowing kind of situation, your access, your GPAD kind of situation. We're absolutely clear that inspectors are reviewing this monthly, and that's why it's really important to keep an eye on your email, because those are the registered managers are receiving emails on a monthly basis that are telling them whether they are compliant, etc., with the reviews that CQC are carrying out, and that is going to be carried out into the new single assessment framework 2. Now, using that kind of information that I've talked about, that kind of information capture and review, CQC risk rate practices, low, medium or high, and you can see that quite clearly on that kind of flow. So if you're low, you'll kind of flow into this bit where you'll have this ongoing monthly kind of review that happens in the background somewhere. And stuff like, I must say, CQC don't hold any naughty lists or anything like that. And I've spoken to lots of inspectors, they don't hold any kind of lists about lots of complaints or anything like that. They really do look at some of those key things that I've mentioned, your ARDENS, your ECLIPSE, if a complaint's presented to them, whistleblowing's presented at your access, etc., and stuff like that. If you're kind of deemed to be medium risk, they'll contact you. And I know a couple of practices in Newham have been contacted around when they've been flagged as kind of being in that kind of medium kind of risk category, and they will contact you. They'll ask for some information, and then they'll decide whether an inspection is required or whether they can do stuff over the phone and stuff like that. And once that kind of medium risk review is done, again, they'll start sending you that email and publish on the website that, you know, we've checked this practice this month and things are cool. High risk practices, again, my understanding is that there has been a couple of visits in numerous practices that have been rated as high risk. And that has resulted in an inspection where inspectors just turn up. Severe and get me wrong, don't get me wrong, that I'm quite sure that an inspector can turn up whenever they absolutely want to. What I would say, and Sabeer's nodding his head, is what I would say to you is if you are in that kind of situation, you know, it's just a bit of a health warning. There have been some fake inspectors going around as well, which is a little bit worrying as well. And Sabeer asked, but it's very, very serious. This person was actually arrested. And I believe it was Havering, wasn't it, Sabeer? I think it was Havering anyway. If an inspector apart from all of the stress about the actual visit on the day kind of situation, please do contact the 0300 number for CQC and make sure that you are actually due an inspection, even if it is a surprise one, because we don't want anybody to be walking around buildings as a fake CQC inspector. Yeah, so that's kind of where we are at the moment. This is that transitional kind of situation, and as CQC move to the new kind of single assessment framework. So they are reviewing our sort of data, our information on a monthly basis in the background, and very different to how things were done previously. Steph, could I get the next slide, please? Yeah, so in incoming council meetings, and to do it justice, that's why I've kind of chunked it up and start with the introduction today. We want to be talking about the new CQC single assessment framework, which will cover all providers in much more detail. I've put a note there that the regulations aren't changing. Those are the regulations that we all must comply to. The 5 domains screw are not changing: safe, caring, responsive, effective and well led. But the key lines of inquiry, the CLOEs, are being replaced by quality statements, and we're going to spend some time in coming practice council meetings talking about that and supporting practices with that in time for autumn time when the new assessment framework starts. CQC will be asking for specific evidence, and I've already mentioned some of those things like Ardens and your Eclipse and stuff like that, and they'll now be scoring, so it's going to be much more objective, and hopefully the hope is less subjective compared to what used to happen last time. They're retaining the factual accuracy process. I think that's really important. That's the 10 days that you have after any kind of inspection that allows you to challenge back what the CQC says. And we'll be going through all of this stuff in detail in the next practice council. Do watch that video that Karen's dropped in. Do look at some of the links that I've put on the end of this presentation as well. There's some slides for down. Do some homework, because that will make those sessions that we do together really useful. We only had four practices from Newham represented at that NEL session, so I don't actually know what kind of happened there. Maybe you all didn't want to see me and Sabir, I don't know, but it was a really useful session, and I know, Sabir, that we've supported a lot of practices following that session, and questions via email and phone calls as well. That's all I wanted to say. Sabir, did you want to say anything, or was there anything in the chat?
No, I think what exactly happened now in Tower Hamlet, for the time being, everything is suspended. There was a visit supposed to happen last week, and the practice rang me. They have suspended because of the winter pressure. That similarly things should be happens to Newham, and I added some link here. Public health in fingertips. You must go through and monthly to see where are you ragging. So if there any area you are ragging, that means you are on red or amber, please work on whether it's a cervical smear, whether it's an excess. It's a very useful. This is the one CQC usually use.
Brilliant, excellent. Sabir, are they using fingertips for that monthly review that they do at the moment?
Yes, so there is a multi-source feedback at the moment. Remember, it's not on the day that duty is finished. There will be no on the day. It will be over the period. They will collect information from the commissioner, from the patient, from the social service, from the bars. So there is a multi-source feedback. So it's not like that on the day what you perform. So on the day will be just to make sure that things are in place if there is an issue. Otherwise, everything on multi-source feedback. So it's a system review. So if the system fails, we all fail. So we all have to work together with ICB, PCN, federations, social service. This is our joint game. And if we cooperate each other, it's not a difficult job to do.
Yeah, and I would say that, you know, myself and Sabir are happy to support practices with any kind of questions or queries that they have. I know practices are doing lots of kind of mock inspections and this sort of thing, and have got colleagues in to support them with CQC and stuff like that. That's absolutely cool, but myself and Sabir are always here to help as well, and especially as we transition into the new single assessment framework, which I think will be relevant for all our practices in Newham. We're happy to work with practices to prevent them when that monthly kind of risk kind of situation happens, to keep them in that low kind of situation so they never get a visit. That's an important point to end on, that kind of 5-year maximum kind of stuff, that timeline, that time for CQC to visit within 5 years, that's completely been scrapped now. So it's a much more fluid monthly kind of review. Manuel's put in the chat, it'll be good to know what support is available in Newham, not to be a blip on the radar. Yeah, Manuel, in the coming sessions, I've already mentioned your eclipses, your dashboards. Sabir's mentioned fingertips, your G-pads, your access, direct complaints to CQC, and whistleblowing. And not necessarily, if you get a direct complaint to CQC, doesn't mean that it's going to result in an inspection. You might get a call, but you know, we're speaking to inspectors. If you've got 10 complaints around the same kind of theme, do you know what I mean? Then it becomes a high risk kind of issue kind of stuff. This is all much more objective. And Manuel, what we'll show colleagues in the coming weeks is the score sheets, the quality statements, the we statements, the I statements that make up the new single assessment. So you've put in there, Manuel, what do you mean by a CQC dashboard? Oh, you want to create one, Manuel?
Yeah, I mean, you mentioned a lot of sort of areas where the CQC are actually, like Sabir also mentioned, you know, system-wide. So it will be good to kind of create some kind of a dashboard for the practices to sort of point them out where they are in this system-wide sort of, you know, fingertips data or their performance data, like, you know, all the things that you mentioned, which CQC is actually looking for. So it would be good to put that.
Yeah, absolutely.
That's what
I absolutely agree with you. You know, when I gave this talk at the Nell kind of situation, it was very much about sort of, you know, reflecting on that kind of workload that we have. And wouldn't it be great just to turn up to work one day and have a dashboard that covers everything and not have to open Eclipse, Ardens, Keg, everything and stuff like that. Manuel, you know, that isn't quite there now, but I you know, I don't know if sure Layla's on the call, but when Will's back from leave as well, and I'll pick up with the commissioners as to what could potentially be put together to support practices and what's available in terms of support, because absolutely I think that is super relevant, and why not have something there that we have that a fair amount of control over. I know some of the CQC bits we don't, but that to look at on a monthly basis to make sure that we're in greens rather than yellows and reds. Absolutely. Sabir, hand up.
I just wanted to ask that there's a lot of people are really scaremongering in GP practices to say that they're fake CQC inspector. If the inspector doesn't show you a warrant, please don't let them come in, because no inspection happens without a warrant issue. So this is warrant issue will be coming from the headquarter in Manchester. So please be careful that if you think somebody approached you with a warrant, please let us know. Then I will contact the regional director and we'll see whether this is really we need to compromise or not. So no warrant letter, no entry.
Brilliant. Thanks, Sabir. Look, we're short of time. We could go on and talk CQC for hours and take lots of questions as well. Do watch the video. Do a little bit of homework. The slides are pretty simple and waxified to read. There's pictures more than words, which is kind of better, I think. And there's some links there too. Yeah, please do ask questions, and we'll be breaking it down in a much more chunkable kind of way to support practices in that transition to that new single assessment. Okay, that's all I was going to say on CQC. Vima, over to you.
Okay, thanks, Wax. Good afternoon, everyone. So mine won't take too long. I just want to start off by just following on from Wax's request about the junior doctor strike, because they're trying to do a nail-wide review at looking at patient harm and safety that's come about from the doctor strike. So I know that obviously most of this has been more, the acute being affected, but obviously some of it does spill over into primary care. But if you do have any cases specifically, patients have come to any harm at all, even if it's something like a discharge summary and things that are inappropriately kind of requested or something for this week, then please can you let us know. There is a plan for another strike, which will be 9 days long, after the King's coronation. So I think they're just trying their best to look at what the potential harm could be, and trying to go back to possibly GMC they may need to get involved in this. So yeah, just another request, if you don't mind, either email me personally or just put it in the chat, just to let me know. That'd be really, really good. So future practice council meetings. So I thought this could be kind of more of a verbal sort of discussion. Obviously, today was our first joint meeting, and it'll be good to just get some feedback from you all to see how that went. Personally, I think it was good. I think, we're all stretched so much with time, and if we can try and amalgamate our meetings and make it relevant, I think that'll be good. In terms of going forward, obviously there are going to be hot topics like Wax just outlined in terms of around CQC, around some commissioning initiatives, but also I think it might be a good idea to have some of the kind of the borough partnership agenda on the practice council going forward. We've nearly appointed all our clinical and care professional leaders, so it'd be good to get sort of updates on their delivery kind of programs, just for all of you to be aware and understand sort of what's been happening on the ground, what differences hopefully we're making, and some outcomes that we're achieving. So I think that'd be something that we could try and incorporate going forward. What I might do is not for the next one, the one after, is just to put a survey on the chat bar, just to get your views and see if you're happy with this approach of having a combined meeting. And again, I think it'd be good to get your ideas of what you might want on the agenda, because this is your meeting, this is for all GPs, and it's not just for information. It's about, if there's anything else that you want to know about, what you want to discuss, then please do let us know if you want to just open it up to everyone. So yeah, I think that's it from me. I wonder, Karen and Nadeem, did you have any thoughts about today, how you felt it went as a combined?
Pretty well, actually. I think it's gone quite well, and like you said, it's reduced a meeting per month as well, and I think it's more of a focused agenda, and we're not having to kind of fill in our meetings with stuff which maybe not always appropriate for the people who attend.
Yeah, Rima, I think a lot of content, isn't there, in this way of packing it all in, and I guess for colleagues, just to underscore, we will send out information in terms of newsletters, slides and so on. So it may be that for whatever reason you didn't take it all in, or if people aren't here, that will be circulated further. But I'm keen to support the survey, perhaps, as you say, in the June joint meeting, and that way we said we'd test it for 3 months, and that will give us a bit of a flavour from colleagues as to whether that's working or whether we need to rethink.
Yeah, thank you both. And I guess the proposal is that we'll have this meeting once a month, with the same amount of time, and then just split it up accordingly to the agenda. Wax, did you have a view?
Yeah, when we so the time we have as clinical leads, that's really has been cut down, and as much as we love spending time with you all and stuff like that, and if I speak for myself, it's difficult, it's really stretched, and like I said, we're entering into phase 6 of the COVID There's strikes going on as well. We don't know what's happening from one day to the next. And now, right now I'm thinking I don't, need to focus on one for practice council at the end of the month, when I know there's going to be more junior doctor strike and fallout, and we're still in this kind of recovery reset phase, whatever you want to call it, and stuff like that. So yeah, and then we're in the midst of that COVID vaccine phase 6. So that feels more comfortable as a clinical lead, and what we said a few meetings back was that we recognize that all the hard work that everybody's doing, it's not easy to get out for every Friday to come for a meeting, even if it is online and stuff like that. And then ICB's in consultation mode around the admin support and everything, and the roles for ICB staff as well. And so we don't know how that's going to impact. So, I think becoming super light and super efficient does make sense. What I would like to see was, I know if Kat's still on the call, but if we were able to do a once a quarter, maybe face to face, and let me just throw that into the mix as well. I think it would be nice to see people face to face and try and get back to some semblance of normality, especially if we have tried to be efficient in trying to bring meetings together. And then the final point was, absolutely, like we've got opportunity today. I think it's really important to make use of that chat bar function, and also make sure we leave plenty of time for discussion, etc., and matters arising in these agendas, because it's really, really important to hear everybody's thoughts and perspectives.
Yeah, okay, thank you, Wax. Tammy.
Yes, sorry, thanks, guys. So again, I think it's about the purpose of the meetings. There's a lot today, isn't there? There's a lot of push, but what we don't get is any opportunity to hear the voices from the other GPs. So we need to kind of increase that forum and that space. So unified voice meetings, please do first Tuesday of the month. Try and pop in if you can. I think it's about us having a space to keep others and kind of engage with what's happening outside. So whether we want to do that on WhatsApp, probably not, but do we want to use our Teams channels a bit more? I just think we need to communicate better. But what we haven't got is the time to hear from practices, and that's really what we need to focus on, if I'm honest. And the other thing really for me is around the fact that just documenting, the difficulties that we're having across the system. So I went to our LMC and the primary care meeting that we have across NEL on Tuesday, and Paul Glooley's really keen to get the information from us from our GP alert system. So it's rolling out in Newham. I'm really encouraging all the practices to, sign up. And I think for us as the ICB and involved in that, we need to be able to show, just like the acutes can, just like the community care can, the difficulties that we're having. So we like to have these meetings. It's good for our wellbeing and it's good for sharing and QI, but actually we do need the system to understand that we need a bit of protection as well, because we do need to do this for CQC and everything else. So I just wanted to make sure we highlighted that. Thanks, everyone.
That's great. Thanks, Tammy. And really important points that you made as well, just, making sure that this is kind of part of a, not just only just for information, because I think we've got different forums, obviously, where practice voice can be heard, but practice council is also about amalgamating some of those kind of voices and discussion as well. So yeah, really important points. Thank you. So yeah, we'll have our next meeting in a month's time. So I think that's on the 12th of May. I've got down. So we'll then review what these meetings are like after 3. Basically, and on the third one, we'll put a questionnaire out at the end just to help us also get some information back from you all. So yeah, if there is anything else, is there any other business from anyone before I think we can close today, unless there's anything else from anyone? No?
3 minutes ahead of schedule as well.
I know.
Sure, nobody's got any
Alright.
questions? No. All right. Good.
No. Okay, perfect. Nice to see you all. And Eid Mubarak to all of those celebrating. It's next week, is it? Do you know? It's next week. Okay. Eid Mubarak to you all as well. All right. Take care.